Hi folks, how are you? I hope you don't get notified from somewhere else. I am doing something different today, completely different. This is Carmen Cawthon with Taking Care of Us. And taking care of us is more than health care. Sometimes it means that there's a coronavirus and you don't really want your child to ride the bus, so you drive her to work instead of letting her take the bus. And so if you can smell, we are sitting in the parking lot of Char Grill, and oh my gosh, the burgers and hot dogs and french fries smell really good. Anyway, I'm so happy to have you all with us. Hey, Jean. Hey, Zenobia. Today we're going to continue our conversation about emergency situations, and we were in the emergency room. Just a quick reminder, whenever you are having to help take care of somebody, you want to make sure you've got the patient's legal name, not their nickname, their date of birth, social security number, insurance information, your medication list or your bag of medicines, your diagnosis list, and if some kind of notepad, something to write on. I'm going to repeat this from Tuesday's session. Be prepared to wait in the waiting room for a spell, and that can be hours. Don't be surprised to see people who've got hanging IVs in the waiting room. If you think if you're worried about your wait time, a lot of ERs have posted on their website how long the wait time is. You're going to see the nurse first for what they call triage. They'll check you out, check your temperature and your pulse, your blood pressure, your oxygen, and determine how quickly you need to be seen. Then when and if you get back to a room, you'll see a nurse and then somebody from registration and then the doctor. You are not allowed to eat anything or drink anything until you see the doctor, and sometimes until the tests come back. One of my friends who is a nurse reminded me that the reason for that is because if you need emergency surgery, your gut, your stomach, your intestines will be empty. It can be problematic to have anesthesia on a full stomach, so that's not something you want to do. And the other thing I want to remind you is that test results usually take anywhere from 60 to 90 minutes at least to come back. Normally there's a chart on the wall that tells about what the wait times are for testing. Okay, we're going briskly today because not only did I have to bring my child to work, but I'm caregiving and taking somebody to the doctor, and so I may have to cut this off and finish on Tuesday because I need to be leaving to go pick her up. So what happens when the test results come back? That's where we stopped on Tuesday. Once the test results come back, the doctor or the PA, which is a physician's assistant, that might be who you're seeing, are going to come in and go over the test results with you. If they don't find anything, you'll probably be told some further things to do to help keep your situation straight and be discharged. If you've been put on an IV or given fluids and those are not completed, they will complete that process and then ask how you're feeling. Then you'll probably be discharged. If you're still having complaints, you might see a specialist, although that normally happens closer to the beginning of the time that you're in the room. If your tests come back and some issue has been diagnosed, the doctor will talk to you about what comes next. Next might be a hospital admission. There may be more tests done to narrow down the diagnosis, or there may be a discussion of some treatment options. We'll talk a little bit more about hospital admission or other treatment options. If you're going to require more tests, it's probable that you're going to remain in the ER for those tests. However, sometimes it's possible that those tests will require a hospital admission. That would be a discussion for you, the caregiver, the patient, and the doctor. But the doctor's recommendation is generally one you want to take seriously. Don't dismiss it out of hand, but, get all the facts that you can before you make a decision. Okay, we're going to talk about hospital admissions on next Tuesday because that's a little bit of a process. I'm going to talk about the discharge process right quick. If you're feeling better and the symptoms have been addressed and the doctor feels that you're able to go home or wherever you came from, they will order your discharge. That comes after the doctor has come in to tell you what they did or did not find. They will not discharge you, or they should not discharge you, if you have not talked to the doctor. If somebody comes in and says you're being discharged, and it's the nurse, and you want to talk to the doctor, that's what you went for. So tell them that. They'll discuss whatever options there are available, and if you're going to go home, they will tell you what you need to do to continue to improve. And then the doctor will leave the room. The reason for that is the doctor has to go back to the station and write up the discharge order. Just because they say you're discharged does not mean you get up, put your clothes on, and go home. That has to be entered in a computer, and the nurse will have to receive the discharge order and then print it out. The nurse normally comes back to the room with the paperwork as well as any kind of paraphernalia that they need to free you up from any IVs or monitors. Do not try to take the stuff out yourself. That's a no-no. It doesn't matter if you're already a nurse or a doctor. That's still not your job. Your job is, you're the patient at that point, or you're the caregiver. Sometimes if they've done an EKG, they put these sticky leads on you. There are like 9 of them, I think. So they put these leads on you, and they're sticky. And sometimes when they come and they pull them off, and it does, there's a little sting to it. They might miss 1 or 2. There might be one under your rib cage. There might be one on your side. They miss. Those you can take off when you get home or when you feel them. After the nurse removes everything from you and goes over the paperwork, because the nurse will do that. The nurse will go over whatever paperwork there is. It's called the discharge summary. They will go over that with you. And they're going to ask you then if you have any questions. If you have some questions, that is the time to ask them. Do not try to call the ER back and say, I left about 2 hours ago and I forgot what she said do, or what the doctor said do, or what the nurse was telling me. Write it down. That's why it's good to have somebody else with you, because they will remember things, or they can write things down while you're being taken care of. Okay, so if you don't have, your questions have been answered or you didn't have any questions, the nurse is going to ask you to sign a copy of the paperwork showing that you were discharged and that you received the instructions. That is liability for them. That's to make sure that they can say, we told you what was going on. We told you what you need to do to take care of yourself. We told you you needed to make some phone calls to some doctor's offices and schedule some follow-up appointments. That is to make, when you sign that paperwork, that means that you understood what happened. So you can't come back after them if you don't do something. Okay. The nurse, after you sign the paperwork, will tell you that you can leave after you get dressed. They should ask you, or they should ask the patient, if they are able to walk themselves out, or if they need to be taken out in a wheelchair. And if that's the case, ask for it. There's no shame in that. Ask for it. If you don't feel like you're stable enough to walk to the car, or if they've given you a sedative, or if you were lightheaded or dizzy when you came in and you just want to be sure you get to your vehicle okay to get home, that's absolutely fine. And if there's someone with you, they will probably tell them when they bring the wheelchair to go ahead to the car and drive around to the door, to the entrance, and they'll wheel you out. You don't want to fall on the ground while you're walking, kind of wobbly, and you don't want to have to walk too far and make yourself feel worse. The paperwork that you're going to get usually consists of a discharge summary that tells your patient name, the hospital name, the date of the visit, the diagnosis, medication changes from what you normally take, if there are any, follow-up appointments that need to be made, your medication list that they went over with you, the reason for the hospitalization, as well as all of your other diagnoses, any allergies that you have, and any other. Sometimes they'll, most of the time, I don't think we've left the hospital in the last 10 years where there has not been other information pertaining to your diagnosis. It's just general information. It's kind of generic to the diagnosis about how to take care of yourself with that kind of situation. The last thing I'm going to tell you is, unfortunately, I tried to make a list of the kinds of ER visits we've had. For pediatric visits, we've had earaches, inability to urinate, medication reactions, sprained and broken ankles, severe staph infections, acute nosebleeds, and issues after surgeries. For adult things, we've been for strokes, high blood sugar, fractures, extreme nausea and vomiting, kidney infections, geriatric medication interactions that led to abnormal behaviors, emergency eye surgeries, gout, kidney disease, AFib, which is a heart condition, MRSA, and gallbladder. That's all I'm going to share with you today. If there are, we'll go over the discussion or hospital admissions and what that looks like from the ER on Tuesday at noon. If there are questions that you have, if you want to post them in the comments here, or if you want to start a discussion about other questions that you might have about hospital admissions and hospital stays, please do that on the Taking Care of Us page, and we will try to make sure that we address those things. And we still are going live on Tuesdays and Thursdays at noon. If you are not able to watch us live, please watch the replay and just put hashtag replay in the comments so we know that you had the opportunity to see it. Thank you so much for joining us today, and we look forward to seeing you next time. Bye-bye.